Chinedu Okpara is in his 50s. He walks into a local health facility in this community in Abia State, where he meets the nurse on duty.
Good afternoon. You're welcome.
He presented his symptom to the nurse, and one can hear the palpable trust in his voice.
Okay.
The nurse listens to him with rapt attention and goes ahead and takes his vitals. Recording every details. When she was done, she picked up a telephone laying on the table and dialed a number. For Nurse Ngozi in this other health center in Ward 3, Umaya North, it's another day in the office. A patient walks in and presented her symptoms.
You're welcome. How are you? What of your family? You're welcome. What can we do for you?
In the past, Nurse Ngozi would have been afraid to attend to her because of the fear of the unknown, as she isn't a trained doctor. But today, she listened with rapt attention, and when she was done, she took the telephone and dialed a number. On the other side of the lines are trained physicians. They are doctors trained to take these calls and are the reason these nurses in our story are confident. They are part of the team who makes up the Dial a Doc, the Abia Tele-health initiative.
I'm Dr. Chimobi from Dial a Doc Direct, Abia State Tele-health initiative.
I'm Dike Ngozi, OI Samuzuku Health Center.
Yeah, good morning. How may I be of help to you?
Doc, I have a patient.
At the inception of his administration in 2015, Governor Okezie Ikpeazu identified sound healthcare services as one of the enablers of his 5 development pillars aimed at delivering better life to the people of Abia State, and proceeded to map out and implement strategies to ensure improvements within the sector through capacity building, deployment of technology, modern equipment, and well-defined deliberate actions to be taken to ensure that life expectancy in the state surpasses the national average. And one way it is doing this is through the Abia Tele-health initiative.
Telehealth is an initiative that connects our entire health architecture to a team of doctors, because we understand that we can't put doctors in every primary healthcare center. We have a hub where 15 doctors or so walk round the clock, and they speak all the dialects, vernacular and everything there.
When Governor Okezie Ikpeazu conceived the Tele-health initiative, many cynics saw it as a jamboree and a project that is an exercise in futility. But Governor Ikpeazu, undaunted, forged on with the plan. Then came COVID. With the streets of Abia State and Nigeria locked down, healthcare and visits to the hospital became a luxury. Thank goodness for Governor Ikpeazu's vision. The Tele-health came to the rescue, as it became a veritable vehicle that Abians used in contacting doctors and getting treatment.
That speaks to a lot of things. That speaks to vision. That speaks to commitment. That speaks to proactivity. To a different level, it might even be said to have spoken to clairvoyance, because it was very difficult to sell this idea to the leadership, you know. But immediately we engaged Dr. Ikpeazu, His Excellency, Governor of Abia State. It was like we had that discussion before, and he says in his words that he had always known that destination of healthcare is digital. That's a phrase I use now, you know. And then he was committed to it. He had